In an operating room, you have to love working on a team and working with a whole bunch of different disciplines to make it work for the patients.
Safety is a major concern of all aspects of the operation. Before the patient even enters the operating room, we have a huddle. During the huddle, we discuss various aspects of the case, how long we expect it will take, any special equipment needs that we might have. We communicate between the anesthesiologist, the nursing team, the team that will make sure that we have all the proper equipment. Before we actually make any incision of any kind, we have a timeout. What the timeout means, we stop everything, we confirm the patient's identity, we confirm the operation, we confirm laterality or location of the operation if that's an issue. We make sure that antibiotics have been given, and we make sure that there are no other concerns before we proceed.
The anesthesia team is an essential part of the safety of the patient in the operating room, beyond just the care provided through anesthesia. They are actually part of the team that is ensuring that we have the patients receiving the right procedures, the right care, that the team members are assembled in the proper manner and timing.
One of the key roles of the nurse in the operating room is around patient safety. There are three key roles that nurses fulfill in the operating room. One would be in the circulating role. The circulating nurse is a nurse who has completed her education training as a registered nurse, but has to go through an extensive 9 months to 18 months of training to be in the role in the operating room. Second role would be in the scrub role. The role of the scrub nurse is to be standing almost elbow to elbow with the surgeon or the surgical resident that would be assisting the surgeon. And they're responsible for all of the instrumentation during the procedure. So they're anticipating what the surgeon is going to need next for the surgery. They're looking at their back table. Do they have that instrument there? If they don't have that instrument, working with their circulating nurse to get that there before the surgeon would need it.
One of the biggest roles of the MGH is that we are a teaching institution. There are trainees at all levels of all aspects at the MGH. My specific interest is in the training in surgery, both for medical students, residents, and fellows. Medical students are obvious. They have no degree. They're there to observe, to learn, develop knowledge and exposure to the various fields, most of which won't even go into surgery, but it's part of the general education of a medical student. Once people choose to go into surgery, they begin training in a residency. Residencies vary in length. In my field of general surgery, it's 5 years. The whole practice of the training of surgery is based on incremental increases in responsibility as the trainee learns more and becomes more accomplished in the field. What they know during day one or year one, we build upon that every year until they finish their 5 years. The fellowship consists of people who've already completed their entire training in their first specialty, and then they go on for advanced training in a second specialty. Most of the time those individuals are very highly accomplished, very experienced before they begin their fellowship, and it's their goal to add to the expertise and experience in the area which they choose.
Most patients don't realize how many people are actually taking care of them in the operating room. The anesthesia teams, the nursing teams, and the surgical teams have a lot of different members on them, but there's also members supporting those functions from the perioperative services. At any one point in time, there could be 8 to 10 people in the operating room providing care to the patient.
In an operating room, you have to love working on a team and working with a whole bunch of different disciplines and how everybody kind of comes together.